Chief Nursing Officer of Grenada and outgoing chair of the CARICOM regional nursing body, Ms. Nestor Edwards, has called for great investments in the nursing and midwives professions. The call came as she addressed the opening of the 46th annual general meeting of the RNB on the 6th of August 2019 at the CARICOM headquarters in Guyana.
I think that our governments need to invest more in nursing and midwifery. Nurses make up over 50% of the entire health workforce, and as such, they must be valued for the contributions they are making towards health service delivery. Nurses need to have more resources to do their jobs, both material and human resources. It is well documented by the International Council of Nurses that safe staffing levels save lives, and so we need to have adequate numbers of our nurses in order to achieve the health-related goals and targets and to transform the health systems. Nurses need scholarships to pursue advanced training, and they need to be recognized for the contributions they are making.
Touching on the issue of nurses' migration, Ms. Edwards said,
"Within recent times, the region has been experiencing what I would call a hemorrhaging of its nurses to other developed countries, particularly in North America. And as the regional nursing body, we call upon regional governments to implement retention strategies, because not only are our newly qualified nurses leaving, those more experienced ones are also leaving as well. And there are reasons why poor retention strategies is damaging. It is linked to overwork and poor working conditions. In other words, the few nurses who remain can become burnt out, right? It can have negative impact on the quality of care, as well as it can negatively impact on cost and productivity.
Recently appointed Director for Human and Social Development at the CARICOM Secretariat, Ms. Helen Royer, underscored the importance of the nursing and midwifery professions to the health and wider development agenda of the region.
We realize that health is an important investment in people, and it is actually necessary for sustainable development. When we look at the nurses, both the midwife and the general nurse, you would realize that nurses, they represent the highest percentage of the health workforce. That means to say the role that they play cannot be underscored. They are pivotal to the enhancement and advancement of the health agenda. And my expectation would be that they would help shape that agenda. And they could do that in several ways. If we look at the competencies in the area of the education training, I would expect that both nurse midwife and the general nurse would be very well informed, and they would be able to have the capacity to be able to transform a lot of the agendas that we have at the level of the member states.
She shared briefly on the relevance of this strategic plan, which she said,
"Actually, we just had this meeting with the regional nursing body, and one of the key activities of that meeting was reviewing the strategic framework. And the priority is actually on four main components. It is about nursing and midwifery education, governance, leadership, and training."
Incoming chair of the regional nursing body highlighted the implementation of the strategic framework as one of the several priorities of her tenure.
There are some priority areas I would like to work on during my tenure. As I said, we've just completed the strategic plan for nursing and midwifery 2020-24. So apart from that now, we'd like to work on the implementation plan for that strategic plan. not just working on and completing the implementation plan, but to also see the implementation of the implementation plan, actually implementing the plan. Also, what I would like to see during my tenure going forward is the harmonization of midwifery education, midwifery practice throughout the region. We have started to work on the harmonization of the curriculum, so I would love to see that through to the end before the end of my tenure, God spare life.
Welcoming the opportunity to serve on the body, Ms. De Silva voiced her expectation.
My expectations is to work diligently to achieve the mandate of the regional nursing body. Also to get the support and buy-in from all stakeholders where the mandate of the R&B is concerned.
Dr. Oscar Ochoa also shared his thoughts on what was the major highlight of the meeting for him, elaborating on the issue of the assistive nursing program.
As members of the regional nursing body, we are extremely sensitive about the growing shortages in the availability of nursing and midwifery personnel. And as a consequence, we recognize from a policy level, different governments are using different strategies to help to meet the demands for services, albeit with the use of less qualified members of the health team. And as a region, we recognize that this is an initiative that will need our support.
The R&B acts as a coordinating mechanism for the meeting of government, chief nursing and midwifery officers, and other institutions responsible for education and regulation and nursing and midwifery in the region. The CARICOM endorsed and supported body was formed in 1972 and comprises representatives from the member states, associate states, and regional institutions.